17 weeks pregnant, congratulations. Have you ever felt the baby move? Want to know everything that is happening in your body, all the changes, tips of what you can bring to alleviate everything that is happening with your baby? What are the news? A development, belly size, fetus size, weight, how much has grown, how much will grow, feeding tip, and special tips for this week. So stay with me and I'll tell you. Hello, I'm Monica Romero. I'm very happy to have you here with me. Congratulations! Did you know that the 17th week in our Gregorian calendar, the one we normally use, is equivalent to the very end of our 4th month? Well, you are already at the end of the 4th month, going to the 5th gestational month. Time flies, and now 17th, you are arriving at the end of the half of your gestation. With 20 weeks, you have reached the middle. Passes quickly, right? While there are so many changes, it seems like we've been pregnant for a long time. Time, if you stop to think about it, it ends up running a little differently when we're pregnant, right? And let's get to the news about you, about your body. Look at that belly. How is she growing? She has grown a lot, and now her uterus can already be felt about 4 centimeters below her belly button. What does that mean? As your uterus grows, it comes out there under the pelvic bone and reaches the top of your belly, leaving that more beautiful pointed belly that we love. Of course, the thinner you are, the easier it is to note this belly development. But now, in a little while, all the bellies will be evident. See? Even if you're a little bit more overweight than the difference, yes, because your uterus is growing, there are hormones that are making both progesterone and mainly, in this case, relaxin. It makes our joints softer to facilitate, accommodate this growing uterus and also childbirth. So our hips are different. We will have a change in our gait. We will have a gait similar to that duck gait, right? More to the side. If you don't have that level, calm down. Your time will come too. See? We have all been through this, and you will start to realize after a while that you will look like a gap between 2 cars you will not be able to pass. But before you pass, you will discover that you can no longer pull your belly. We can't pull your belly. You can pull. It doesn't make any difference if you get it. And how is all this happening to you? It may be that when you choose that outfit to go to work or to go out or to go to a party or to go to the supermarket, the basic outfit is not serving. And we look in the mirror. Sometimes we don't like our clothes. We can't make them look good, or we look chubby, or we don't feel pretty. Calm down. There's a lot going on right now, okay? The first part, yes, is your body is changed. It is different, and it is natural that the clothes that used to dress super well may not dress so well now. So looser clothes can help you. If you don't want to invest a lot of money in maternity clothes, you can look for a thrift store or talk to that friend of yours who recently had a child who may have an outfit in her wardrobe. We use very little, okay? So after your pregnancy, the clothes you have acquired, donate or lend to your friends, will do you good and come to them too. We can make these clothes circulate the same way we do the first months of a baby's life that we hardly use, right? It uses very little and already loses during pregnancy. It's more or less that too. So that's the first step. And the second step is you remember that your hormones are also in full swing. So it's natural that you have mood swings. To cry easily, to feel more sensitive, alone, vulnerable, misunderstood, and calm. It's not just because it's your hormones that are doing this to you that you have to feel wrong for feeling this way, okay? If you're feeling it, it's a real thing. Validate that feeling, understand why it's happening and how best to deal with it. However, if you are feeling very sad, it may be time to seek professional help. Yes, you can. Having depression during pregnancy, we know more about postpartum depression, which is when there is a drop in hormones. This is more famous, but this increase in hormones can also cause depression. And if this is your case, look for specialized help. It's natural for this to happen to you, but it's not natural for you to deal with it alone. It's very difficult. It's a bar. Imagine that your hormones are already messing with you, and you still have to deal with such strong moments of sadness, right? Not finding happiness. So get professional help, okay? Another point of attention is that if you are feeling your leg veins more painful or you have a family history of varicose veins, you should start wearing medium understanding socks to be able to prevent even these varicose veins from happening. If you don't avoid them all, at least you will have a lower incidence, and you also need to improve your circulation. How do we do this with light walks? This can help you every time you are sitting or lying down. There is a support under your feet. Your feet are raised more and stimulate circulation, right? These areas that are most difficult for our heart to reach, we have to help always lie down on our left side when sleeping. This also relieves a vein called the vena cava, which will make this circulation run better. All this can help you, okay? However, talk to your doctor about anything, okay? It's not to self-medicate, no. It's to apply creams that are not recommended by your obstetrician or by a doctor who knows that you are pregnant, okay? And another thing that requires extra care is that as your belly grows, your center of gravity also changes. You were like this before, now you're getting like this. So measures that change the center of gravity make it easier for us to lose balance. And our spine also changes its shape, which can put pressure on the sciatic nerve, which causes a lot of back pain, a pain that reflects on your legs. It's hard to get up, it's hard to walk. And if you have a young child who still holds it in his lap, the probability of that happening goes up. So please try not to lift too much weight. If you have a smaller puppy who asks for a lap every time he asks, make it a joke to go to the couch and pick him up while sitting. I know it's not always possible. When I got pregnant with Larissa, Lucas was 9 months old. He didn't even walk yet. So I hugged a lot, and I know exactly what it's like to suffer from this pain, okay? If the pain becomes so intense that you can't take it anymore, walk. Which happened to me. There is even an injection that can help you, but only your obstetrician can give it to you. Okay, I don't mention names of medicines here in the channel for your safety. So if by any chance I have really intense pain, talk to your doctor. In the meantime, try looking. It is not to lift too much weight, maintain proper posture, sleep on the left side, have a support on the belly. The less effort you put into yourself, the easier it will be throughout your pregnancy. And lastly, if you notice your belly, bumping belly, don't be alarmed. Your baby may have hiccups. As I said in the previous weeks, he can already hiccup, which will help develop his entire respiratory system. So if you notice the little tummy there jumping, it's your baby sobbing, and it's okay. It just means he's forming properly. And since we talk about baby, let's talk more about your puppy, that in 4 weeks he can increase weight in height up to 6 times. His growth speed is very fast, so much so that this week he is already measuring between 11 and 13 cm and weighing around 110 grams. It's a pear. Look what a delicious pear. My feather, it's tastier than we've ever seen in this life, right? It is in this week that your baby starts to get fat, starts to form the adipose tissue that is very important for the temperature control that your baby will have to do after he is born, because now the temperature control is being done by your body. And it also begins to form the famous caseous vernix. Although the name is a bit strange, in fact, this white substance that we see in newborns, like in this photo that I'm putting for you, this worm it is very important to protect the baby's skin and helps a lot during normal birth, because he's also a little slippery. And it is because of all the benefits of this vernix on the baby's skin that the recommendation is not to bathe the baby with soap in the first week of life, only with water. Vernix continues to protect your baby, and what we want most is a protected baby. Your baby is already training and getting better at sucking and swallowing, and you can catch him already sucking his little finger. In the ultrasound can happen. Your baby teeth are already starting to form inside the gums, which is also very important for your baby's development. And that is why fluoride intake is indicated for pregnant women. If by chance you are not ingesting, for example, do you know this treated water from cities? She already has 111 portions of fluoride there that is placed artificially. If you're not taking this tap water from the filter, for example, it's cool you have a chat with your doctor to see if you need to supplement, because fluoride will help a lot in the quality of your baby's teeth. And as your baby since last week has already taken control of the muscles of the face, already makes faces, he also already yawns, he already plays. He already sucks his finger and all that when he is awake because he still sleeps a lot. However, when he is awake, he also moves around a lot. He is an athlete and his size is now equivalent to the size of the placenta. That is, he is increasing more and more, occupying increasingly more space inside the uterus, and it gets easier still to feel. So tell me if you've ever felt your baby. If you haven't felt it, calm down that in the next few weeks you will definitely start to feel some. It's like a soap bar, you know, that bursts inside the belly, or else a little butterfly that bumps very gently inside. And these movements are getting more and more intense, stronger, until the time it stays in Ali's belly moving a lot. Yeah, it'll come to you in that moment too. I know you're super anxious. Feeling the baby moving is one of the best moments we have. It's great. It's a sign of vitality that our baby is well. So it'll start in a little while, okay? And don't forget, see, he's already started running away from the lights. Remember I told you before? He's running away from the lights and his little eyes are getting more and more mature. So you can put a little flashlight that you can see that your little baby will fiddle with too. And in my food tip, as you know, these are suggestions for you to always be diversified. When your menu, I will tell you to put a little bit of seafood, fish, in addition to being delicious. They also have omega-3. It helps a lot in the baby's brain formation. So it is also important that we put it in our diet, or if you do not eat these foods, supplementing them is important. Not all fish will have omega-3, but you will find plenty, for example, in tuna, in a tuna pate. Oh yes, you can even talk. Good, huh? And for the tip of the week came a tip that I haven't given yet either. Well, it's very important. Do you wear glasses or contact lenses? Are you feeling discomfort? Or does it seem like you have changed to some degree? Yes, it may also have changed because of the increase in blood flow that can put pressure on our eyeball. This can change our grade during pregnancy, so consult your ophthalmologist. You may have to stop wearing contact lenses if you are irritating your eye too much at this time, and change the degree of your glasses, but it tends to improve after childbirth. And my last tip is that I am very, very worried about your emotional situation. How are you? You're okay? Because sometimes we have a scare. It can suddenly be a car accident or the loss of a loved one, and how much that affects a baby. We know that when a scare happens, something that impacts the baby can be quiet, especially your baby is already bigger, you feel it. He can be a little quiet for a few hours, but this tends to improve. And the good news I have to give you about this, if your baby is going through it and you're worried, is that it's like normal in everyone's life. All people go through scares, bad times, good times, and this will do. It's part of your son's life too. What does that mean? What he is going through inside the womb is a preparation for feelings as well, which he will feel outside. Of course, he doesn't know exactly what's happening, but having these changes goes from good to bad, from fear to euphoria, happiness, or crying. All of this will also happen in his post-utero life. You're not offering him anything different than what he's going to have in his life. So that's okay, okay? Going through moments of stress is okay. What can interfere are prolonged moments of sadness, such as depression, for example. These prolonged moments of sadness or prolonged stress can even affect the size of your baby, or even cause premature birth in some more serious cases. So if you are having prolonged moments, it is worth seeking medical help. But if you had a scare, something like that makes you feel reassured that even premature birth can't be caused, okay? What can happen is if it's some accident, something that involves more things than our emotional, right? Something that harms our physical health. Could it harm the baby? Yeah, but it's getting scared because something fell. That's not going to cause a birth, okay? This turns out to be another myth. So that information is there for you. If you like this video, don't forget to let me like it. It's been a pleasure to follow your pregnancy with you. Thank you very much for this privilege. See you in the next video, and mark a pregnant girl to come here too.